This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo. Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary allergist and dermatologist, and...
I'm Janet Novotny-King. I'm the doctor's sister, and I am not board-certified in anything. I'm a pet owner, lover, and rescuer, and we're here to share some really good science-based information so that our pet owners can be better pet owners. I've learned a lot because I'm used to calling my sister at 2 o'clock in the morning because someone's barfing or there's blood somewhere. So it's really nice to get all this info and be a little smarter about taking care of our pets. So who is on today?
Well, first of all, vomiting and diarrhea aside, today is all about allergy.
Okay.
What your pets look like with allergy, how we diagnose it, how we treat it. And we've got my go-to allergy person, Dr. Alana Lisano, who's a graduate of Colorado State College of Veterinary Medicine. And Janet, you'll find this interesting. She actually went to undergrad on a running scholarship.
Oh.
A biology and equine studies major. Huh. Well, she practiced in general medicine on the East Coast in New Hampshire and West Coast in Colorado, and then went to work for my favorite allergy company, Heska Antec, as their manager of the allergy assessment and treatment program. She is and was my go-to person for any questions about how do I interpret this blood test for allergy, what do we put in the allergy solution. I've directed all my referring veterinarians to her because it's a lot. When you don't specialize in allergy, as a general practitioner, you have a lot of questions. So she is my go-to person. I can't wait to see her and talk to her again, Dr. Alana Lisano from Heska Antec. Welcome to the show. It's all about allergy today. So welcome, Dr. Lisano. We are so happy to talk to you today. Everything about allergy. And as I said before, you are my go-to person, not only for me, but for my referring veterinarians that had questions. And it's so nice to have somebody that can address those questions accurately and up to date. Because as you know, allergy is morphing every day. It's a dynamic process.
Constantly changing.
I feel like there's going to be a lot of itching and scratching talk going
Are you ready
today.
for it?
Okay. I'm ready
Well,
for
Janet,
it. So
Janet, can I tell you, that's a very interesting thing because that kind of marks the difference between allergy in humans and allergy in dogs and cats. We don't tend to itch and scratch. We tend to have more upper respiratory. And that's why people have Dr. Lisano and my phone number on speed dial at 2 a.m. when
you can't sleep.
You know?
Yeah. Well, and Dr. Jeroman, you definitely outweigh me being a boarded dermatologist. That I respect you so much talking allergy every day. You have a hard job.
I definitely outweigh you.
Stop, because her head's already big as it.
I definitely outweigh her. I can tell her that physically, I can tell you that. Anybody that gets a running scholarship, I need to keep up with that.
I know. How cool is that?
That was so cool.
I do still run. It is, 2 reasons. Stress relief is number one. Yep. And number 2, it's my time away from my kids.
Yeah.
Yeah.
And
I get it. I used to go to Target for like 15 minutes and feel better.
My stepdad always says, well, how long do you have to run before you decide to turn around and come back? It depends on the day. Exactly.
When I was talking to Janet about your bio and that you're a runner and you have 3 kids and 2 cats, no dogs.
No dogs.
I'm curious. The cats don't want a dog. Did they vote or what?
No, it's more, well, my husband's a vet also. And so it's more like schedule and all of the other things. Cats you can just leave alone and they're good and you're good. Yeah. You can go on vacation for a couple days. They're fine. Dogs, it's a whole other responsibility. And we took on the kid responsibility instead of the dog over the last few years. That being said, we are seriously considering getting a dog in the near future. So,
yay!
Yeah. So we hope to add a dog to the pack. And we're looking at a So one of my friends works with guide dogs, and they often have the fails, if you will.
Yes,
So
yes.
so we might be in the allergy camp. You never know.
Well, Alana, I have to tell you, Dr. Emily Rothstein, a fellow dermatology colleague of mine, adopted one of the rejects.
Yeah,
That's
yeah,
not a nice
I know.
word.
They don't pass it.
Lab
That's
from
okay.
guide dogs, and that dog is we talked to her about it on the show, didn't we, Janet?
Yes,
So
we
that's
did.
yeah,
awesome.
that's really great. Yeah.
Yeah.
And I think my friend Melanie is on her third or
Oh, that's
fourth.
Oh, a
great.
reject? You mean from training?
Yeah, because we have a place right here, right over the border in New York, where
Oh, that's
yeah,
right.
and they've been great
Yeah.
dogs,
Oh, that's
fantastic
awesome.
dogs.
Yeah.
I think she has Rosie right now. They've all
Well,
been
Janet,
black labs.
you might as well start because we have not only questions from Janet, but also from our viewers about allergy.
Oh, please.
And so,
That's
Janet,
great.
yeah, we do a lot of questions.
Well, why don't we start at the very
Oh,
beginning? Well, what defines what is an allergy?
Oh, that's a big question. So allergy is when there is an immune response that normally should be quite low and the body should consider normal, but the body reacts abnormally to a substance in the environment usually. So it could be anything from grasses or trees or dust mites to food. And it's often hard to pinpoint what.
And it's something that in tiny amounts you overreact to, but people that aren't allergic to it just tolerate it. But having said that, when people come to me and say, I want to find out what my dog is allergic to, and I stop them in their tracks and say, I can do that. But what are you going to do about it? What if
That's
it,
a
what
great
if it's
question. Yeah.
ragweed? You can't avoid it. You
Right.
just can't. And dust mites, Dr. Lozano will agree with me, it's the most common allergen.
Mhm.
And you can't get rid of them.
No,
I don't
you
care what
can't.
you do.
Lower the amount, but like Alana just
Right.
said, it's when you're that sensitive to even a teeny tiny amount. So finding out what they're allergic to is okay if you're going to do something about it. But and we're going to talk about desensitization later, but if you just want to know because you think you can avoid it, it's impossible.
And
not
Dr.
gonna
German,
happen.
that's so valid because every day we see people looking at, running these panels, looking at what the pet might be allergic to, and then not doing anything about it. And that's not the intent. We really want to make sure we do something about it and give them that relief, right? Yeah, you can't eliminate everything.
Well, and it's regional. I know, I grew up in Ohio, lived on the East Coast, then moved to California, and every year for 2 weeks, this bright yellow tree called
Acacia.
Yep.
Yes, thank you, would bloom, and I'd be a mess because I didn't really grow up with that, right? And I had an allergy to it, and how was I going to get rid of acacia
Right.
trees, right? So the allergist treated me with over-the-counter stuff, but I'm sure it's that way with pets around the country, like a desert environment versus, Midwestern or
Right.
East Coast. So it seems like every human and pet has an allergy. Like you go out to dinner with someone and
swear.
can't be dairy,
It's so true.
right? So
true.
what is going on? Is it because we're diagnosing better or what is it?
That's a great question. I do think that we're more aware of it than we used to be. But it also does make you wonder if there's something else that's changed. And I'm not sure. I mean, Dr. Drummond, I don't know if you have insight on that. I'm not sure what that might be.
Well, Alana, I heard years ago, and this is years ago, it might not even be true now. If you remember in the old days, like for example, one of the astronauts, Frank Borman, who's deceased now, but one of the Apollo astronauts and Gemini astronauts, he grew up and in the out east, and he had terrible allergies and asthma, if I'm not incorrect in saying that. And the prescription then was move out west, move to
Oh, my
Arizona.
goodness. Yeah, change location.
Well, everybody with allergies from here that moved to Arizona, then guess what? They took up residencies there. We moved all these seasonal plants out there. So now allergies just as common there now as it was, say, in New York State or Pennsylvania or the East when everyone made the mass migration. So I think as humans, we've created, more allergies now than there used to be, at least environmental.
That's a good point.
Okay, so for our pet owners, how do I know if my dog or cat is allergic? Like what's going on that would be a sign?
I think it's important to not think that it's normal for a dog to scratch all the time, or a dog to lick his feet all the time, or a cat to barber their hair coat down to where they have nothing. Things like that often pet owners think is within the normal for their pet, but once you dig into it, you realize that it's actually not. So I think just having those recognitions and asking your vet if you're not sure. You say, and after they come in from the yard, they sit there and lick their feet for 10 minutes. That's a valid question to be asking your veterinarian about. Same with ears. Like, they shouldn't normally, shake their head or scratch their ears. So that's something to pay attention to as well.
And
How do I know, like, if my regular vet says, my regular vet could treat, like, if there's something in the ears or a little paw licking, how do I know when it's time to go to a specialist?
That's a great question. Yeah, and I think it really depends.
I'm not trying to pump up everybody's business.
No,
I'm just
I'm
asking.
retired, so it's not going to affect me at all.
I think that is very much a personal preference for the first part of that. I had a lot of, when I was in clinical practice, I had a lot of pet owners that wanted me to do as much as I could before they went to a specialist. But then you always have that occasional one that wants to go straight to the specialist. And I would say, here you go, please proceed. The only challenge with that, and I don't know, this is probably regionally dependent too, but we don't have a lot of dermatologists. And I live 20 minutes from Colorado State University, where we have an entire dermatology service, and the wait is still 6 months to get in and see one. So that can be a challenge too.
Alana, I found that out here because I'm here in Sanibel, and I'm helping out the Golden Retriever Rescue, as I've emailed you. And I'm seeing, there's skin cases that they're having problems with. I'm just doing it, because I want to do it.
Yeah.
And there are not many. And like you said, the wait is hard. It's a long time to get in. And I think, Janet, to your point, allergy in the dog or cat is forever.
Mm-hmm.
Humans outgrow theirs. Dog and cats get worse as they get older.
Yeah.
So we want to get that pet on an allergy treatment at a young age so that their skin changes don't advance to chronic changes that are harder to reverse. So that is a main difference besides the licking, chewing, rubbing, scooting. That difference between dogs and humans and cats and humans. The difference is pets get worse as they get older, and humans, like your son, Janet, your son that was on allergy shots, which we're going to talk about, he's better now, right? And he's off.
Oh, that's great.
Yeah.
Well, he also doesn't live here anymore with the cats.
Oh, gotcha.
Right.
Yeah.
And I feed the cats that Purina, the one you told me to feed them. Clear something. Oh my God, isn't that terrible? Clear whatever. And I got to tell you, my husband,
I've heard great things about it. Yeah, that's awesome.
It's supposed to reduce the allergenicity of the cat by 40%, which doesn't sound like a lot, but I think
That's a lot.
That's a lot.
Yeah.
Yeah.
And I just wanted to jump back, Alice, what you said about that it's forever. That 6 months is probably worth it, right? That 6 month wait.
Yes.
If you have to wait, get on the list. Because you're still going to need that help from the specialist if your pet is really suffering. So, all for that.
So, do they test dogs and cats for allergies like humans? Like I've had the prick test done. Do they do that on cats and dogs? Is it the same?
They do. Very similar. Yeah. So I'm not the one who's doing that. That's pretty much all the specialists that do that part. But intradermal testing just under the skin with the little pricks is allergens. Very much the same for dogs and cats. The main difference there is that they have to be sedated usually because they're not going to want to sit still and tolerate that in most circumstances. And then some pet owners are also not thrilled about having a big bald patch on their dog or cat for the next few months while the hair grows back. That's a temporary situation, but that is an issue sometimes.
Yeah, Janet, Janet, was your son skin tested or blood tested?
Oh, it was two panels. One is environment and one is food.
But did they do the prick in the skin?
On the back.
Okay, yeah, right. We do it on the side of the pet. We also can blood test for allergies, for environmental allergies in the pet. And as a specialist, I used to do both because it's interesting. You'll have some allergic pets that blood test positive and skin test negative and vice versa. So we want to get all the information we can. So we usually combine those results and then sit down, as I tell people, when the kids are all in bed, sit down with those results and say, okay, do these results jive with the time of the year the pet is affected? Because the whole idea of allergy testing these pets is to make up an allergy solution to desensitize, and we call that immunotherapy, which we're going to ask Alana more about. But it has to make sense. If the say this, my golden that's sitting right here, I keep looking down. Say that Annie is licking, scratching, chewing all year round, okay? And it's not food allergy, because I've done that food trial with her. She's dust mite allergic. But say the test just shows she's ragweed allergic. Well, that doesn't mix. Ragweed's 2 months out of the year in Ohio. So you've got to have A, accurate results, and B, know what to do with those results. And that's where the consultation with Alana at HESCA comes in, because you can't just take what's on the paper and just say, okay, this is it. You got to talk about it and think about it.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator-based called NP, or a hydrolyzed salmon-based for dogs and cats called HF.
So please, ask your veterinarian about Blue Buffalo prescription diets.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating, leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better.
So let's talk about immunotherapy, which I know the human part of that because I had a son and a husband who would go for weekly shots. You know, it starts weekly, then it goes to like 2 weeks. I can't even remember. And then it goes to monthly. And they had their own little solution, you know, that they mix up for them. And, you know, and we do our homework in the waiting room. It becomes like a habit, but it works. So can you tell us how it works? And is it the same as it is for humans?
Yeah. So really similar. So, I mean, if you've been through it on the human side, you have a good comparison to the veterinary side of that. Immunotherapy for dogs and cats and horses, for that matter, and sometimes other species too, although there's always that question of, you know, how feasible it is. But the idea is very similar where, you know, like Alice said, looking at that allergy test result, so whether it's just the blood or the blood and intradermal combination or just the intradermal. I love practitioners that do both. That's always the best. I'm with you. Like it's all about looking at those results in the context of the individual, and then coming up with a solution that actually is what that pet needs to be desensitized to. And you start at really, really low dose. So either an injection or there's also an oral sublingual solution that goes under the tongue. So it's one or the other, depending on the pet. I always say, you know, they're fairly equal in effectiveness. So you always pick the one that is the most feasible for the pet owner and the pet that you're dealing with. Some of them, you know, most cats don't mind a quick shot, but don't love stuff in their mouth. And, you know, and it depends on the dog. Like some dogs might tolerate the shot quite well, but, you know, won't tolerate oral solution or vice versa. So it's an important consideration to look at what works for the pet and the pet owner. With all of that in mind, you're going to slowly be increasing the amount of allergen that this pet is exposed to with the idea that they then get desensitized with time. It's not a quick process, as you probably experienced on the human side too. It takes a while. You know, we're talking 6 months plus to really get a good positive response. So it does take some dedication for sure.
But you stick to it. And honestly, once you've desensitized your son or your kid, the difference is
Right.
amazing. I mean, he used to come down to the breakfast table like barely
Oh,
picking his
poor
head up,
guy.
because he couldn't sleep and he was congested. And we're like, "What's wrong
Yeah.
with you?" And
Oh
here
my
it was
goodness.
allergies. And then once he
Yeah.
started, because I'm always like, "Take an Advil,
You're
you'll be
so
fine."
sympathetic. What's wrong with you? You're so.
What's wrong with you?
You know what though?
But it really does work, and it made a huge difference in
that's
his lifestyle.
amazing.
Janet,
It
I
was
have
really
to say to
something.
you personally, Janet, Dr. Lozano, Janet had a diabetic cat, and I was so proud of her that she gave shots.
Oh, way to go.
Because Janet, you are living proof that it's easier to give your cat a shot, and you did it every day, and these allergy shots are like once a week, rather than a pill once or twice or 3 times a day. Pet owners, especially allergic cat owners, are so shocked when I would teach them to get, first of all, I'd say, well, I think the best thing would be, let's find out what he's allergic to, and then we'll put him on immunotherapy, which is a desensitization shot. What? I give my cat a shot?
Yes, you can.
Wait.
Yeah.
We would show them with just some sterile water, sterile saline, how to give the shot. And I'd be talking to them, and they'd say, when are you going to give the shot? I'm like, done.
Yep.
and another great story is I had an owner of a chocolate lab that was allergic. And back then, we weren't doing the oral solution, the sublingual. We were just doing injectable. And she was like, oh, I'm so afraid of needles, I can't do it. Do you know she went on to become a nurse because she overcame her fear of giving her dog the desensitization immunotherapy?
That's amazing. I love it.
I know.
Well, we gave the diabetic cat for 5 years, and the challenge with giving your cat insulin is they have to eat, and it's not like a dog,
Right.
Yeah.
right? And my tips for our viewers are: we put her on top of the dryer on a beach towel because it was our level, right? And then we'd put the stinkiest, most disgusting wet cat food out, so she'd be eating, and it got to the point where she'd just go like raise her shoulders, here it comes. And I never thought I could do it, and I had the whole family trained to do it, because that way, if someone was home, you have to do it at even times during the day, right? So honestly, it was worth it to have the whole family trained, and there's nothing
Janet,
to
I
it.
have to tell you, getting back to allergy shots, it's my favorite way to treat allergy because it's natural. You're giving them what they're allergic to. It's not really a drug.
Right.
And secondly,
Right.
it's the only treatment for allergy that has the potential of curing the allergy. I mean, when can you cure a genetic disease? That is amazing to me. Yes, and like Dr. Lozano said, it takes a while. But listen, this allergy is going to be forever and get worse as they get older. Let's get started.
And I'm telling you, it worked with 2 humans in my life.
That's awesome.
That's true.
You know, it
Yeah.
worked. It really worked. So is it the same medicine for humans and for pets?
I love that question. It's such a client question. I love that. It's such a JQ public question.
Yes.
Dr. Lozano can take that one.
I'll try. It should be very similar. The difference would be, what allergens are common in humans, which honestly, I'm not a human allergist, so I can't say for sure, but
Right.
it should be very similar. Yep, where you work up.
Interesting. So how long has the immunotherapy been around?
Oh,
I mean, at least for
over
me, it's
100
been
years.
almost
Yep.
30 years.
It's one of the oldest treatments for allergy as well, which is
I love
pretty
that.
cool because it's tried and true. We know that it works. We know that it's effective. And like Alice said, it actually can have the potential to actually go to the source, not just treat the clinical signs, not just, stop the itching, but actually prevent the itching in the first place. So it's pretty amazing.
And I was nervous about my son going on it because I think he was like in 3rd or 4th grade. And I remember sitting with the allergist going, wait a minute. Like you just said, Alice, there's no drug in it.
It's just made up of
It's
what
the
they're
actual
allergic to.
allergen
Right.
which he's being exposed to in everyday life anyway. But as a parent, I was like, okay, what's the bad
You're
part
thinking
about this?
steroids and all the other things, right?
Yeah.
Yeah.
Are there side effects from immunotherapy?
Yeah, that's a great question. So there can be. If you think about that we're treating an allergy, they can actually, it's ironic that they can have an allergic response to that, right? So especially if you get too high of a dose. One of my best examples of that was, I started a pet on the sublingual immunotherapy, and it comes with 2 different concentrations of allergen for the first set, a bottle A and a bottle B. They're supposed to start with bottle A. Well, this client didn't realize it, picked up bottle B first, started treating, and then their dog's belly, got bright red, horrible, itchy, red belly. And they called, and sure enough, they were using the wrong concentration. So if that concentration's not quite right, certainly you can end up with an exacerbation instead of improvement. But the good news is, that's something that can easily be corrected, something that can be adjusted, for sure.
And Janet,
It happened with me.
What?
With the kid in the back seat in the car seat.
Oh yeah, tell her your story.
Yeah. And so I'm driving, dropping off 20 kids. 20 kids with soccer practice, in the Suburban, and I got the kid in the back seat, and he goes, and he's second or third grade, he couldn't really explain it. He goes, it's like, I can't swallow.
After they've been at the doctor for the allergy shot.
Yeah, and you sit for 20 minutes to see if you have a reaction. Well, they had switched brands or something. You know what I'm saying? It wasn't A or B, that vial thing. And so I call the allergist office. They said, you have two choices, go to ER or come to us. And I'm like, hell, I'm going to them because it'll be faster than ER, right? And then I called Alice, and I'm like, holy crap, he's in the back seat. It's not good. It was interesting because they took us in the room and they gave him whatever the other shot was, and they said, you're going to shake, because I think it was adrenaline or something. I'm not that
epinephrine. Yeah.
And so he was like, but at least they told us that, because that would have freaked me out, right? And then it passed, and everybody was fine, and the throat wasn't.
If I remember this call when you called me, her son was mold allergic. And by the way, we should say this immunotherapy is for environmentals only in pets.
Right.
It's not
for
food.
But
Janet, I remember you told me he was mold allergic, and it was mold season, and they increased the dose. And to me,
that's what it
1
was.
+ 1 = 4 in that situation. Because in practice, I can tell you, let's take the ragweed allergic dog. In Ohio, it's August through October. Actually, the season's getting longer because it's getting warmer longer. But I sometimes would have clients back off a little bit on the dose during their current allergic season. You really need an observant owner. It's just not a matter of taking that list and giving 0.1 cc this week, 0.2. You really have to kind of keep your eye on how that pet did that week. And I think the pets that are most successful on it, A, have the most observant owners, and B, have had allergic kids. Because they know what they're watching.
You're aware.
Yeah. That's a good point.
One of the biggest things I've had in cases that were referred to me is the people just sped through the whole sheet, 0.1, 0.2, 0.3, 0.4, without watching the pet or being told they need to watch the pet. They bring the allergy solution, the paper, and set it on the exam table, say, this didn't work. And I'm like, let's back it up. Let's talk about this, because you might have gone past the dose that it took to desensitize your pet. It's a lot of observation. And to be honest, Alana, I wouldn't want your job, because you're not seeing these pets, and yet they're asking you questions.
Right. And I think, Alice, you have another challenge, because they're the almost, not always, but often the worst cases that make it to the specialist, right? The most challenging cases. That being said, I think that compliance is potentially better by the time they get there, because they really are that desperate for a solution. My struggle when I was in practice was having people give up too soon. It was challenging to get them to stick with it long enough. They'd say, I did it for 2 months and it didn't work. I'm trying to explain to them that it can take longer and to stick with it.
It's our impulsive society, Everything's got to be like that. But Janet...
But that's kind of true, Wade, in human dermatology. Like, I'll go to my derm for something, and he'll give me a cream, and he'll be like, be patient. Like, it's going to take 4 to 6 weeks, because your skin is regen. So it's not going to happen overnight.
But I can sort of understand that, because if you've got a pet that's licking its feet or scooting its butt and it's 2 in the morning, you're like, this isn't working. This isn't working.
You need another solution. Yes.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
As a veterinary dermatologist, I can tell you that the chronically affected allergic pet condition, also known as atopic dermatitis, is rarely ever cured, but it can be effectively managed. Command Deep Cleansing Shampoo from Vetramax is a top veterinarian prescribed treatment for skin problems resulting from chronic itch, pyoderma, and allergic dermatitis.
I like to use what my veterinarian tells me to use, which is Command Shampoo by Vetramax. It's super gentle on the skin and tough on that nasty unwanted bacteria. Libby smells great, she looks great, and she loves it.
Vetramax makes practicing veterinary medicine better by giving doctors high-performing, high-value, evidence-based products. Now, with Command Shampoo, you can bring that same quality into your regular home routine. Go to Chewy.com and enter promo code VETRAMAX15 to save 15% off on Vetramax Command Deep Cleansing Shampoo. Vetramax makes it better. Hey everyone, don't forget to pick up Country Critter Journal if you live in Northeast Ohio. It's a must-read for all pet lovers. Their goal is similar to ours here at the podcast, to educate the community on taking care of pets. They're advocates for adopting from shelters, not puppy mills, and they connect our local communities with goods, services, kennels, and those seeking to adopt a pet. They're a hometown paper with a personal touch, a must-read for all pet lovers, Country Critter Journal. I tell people, let's give it a year to be fair. And I will say this, and there's no proof of this. This is anecdotal. Me and a couple other veterinary dermatologists, for some reason, yellow labs can take up to 2 years to respond to those shots. And I don't know why.
So interesting.
Their genetic makeup, and they're also more sensitive to certain medications. It's kind of like the blonde-haired, blue-eyed child, I think.
You know what impresses me about that is that you waited it out for 2 years to find this out.
Having said that, Dr. Lisano, I'm going to do a shout out to one of our viewers. Well, if the dog is listening, it's Cheddar Bay.
Oh.
And Cheddar Bay is owned by Miss Malavuk, who is a listener of ours. And Cheddar Bay was preceded by Big Christmas, a yellow lab before that. And I have to say, Cheddar Bay's mom, Cheddar Bay, and you can imagine Cheddar Bay is a yellow lab, is really a great mom because she is on the ball with these allergy shots.
It's amazing.
And, she's a wonderful client to work with, and I miss her. And we still stay in contact via the podcast. So.
Those are the clients that keep you going.
Yep. How cute that name is, Cheddar Bay.
I love it.
I know.
Oh, that's amazing.
What I want to ask Lisano to address the cost factor.
Oh, sure.
Because people want to know. This sounds
how does that
really
work?
scientific and real technical.
Yeah, so that's a great question that comes up all the time. My top recommendation is, if you're looking at the cost, don't just look at the test. Look at the test and at least 6 months to a year of immunotherapy when you're considering that cost. Because if, to Alice's point, if you're not going to pursue immunotherapy, then don't bother testing. So you really have to look at both together when you look at the cost. The alternatives to immunotherapy are very expensive as well. So if we're looking at other treatment recommendations that might help your pet, things like Apoquel, Cytopoint, prednisone, they all have pros and cons. Prednisone is really cheap, but it also has a lot of side effects. And when we're talking a lifelong disease, that's a tough pill to swallow.
Excellent point.
So,
and all of these are drugs that you need to have blood work routinely on. So to Alana's point, that's true. It's probably the cheapest in the long run way to treat, and I think the safest and most effective. And I'll tell you something else. I think cats, allergic cats, and by the way, in my practice, the majority of allergic cats were either gold, calico, or tortoiseshell.
Yes.
That gold color to me must somehow be linked with allergy. It'd be a great product for a resident.
Yeah.
What's tortoiseshell?
It's like tortoiseshell glasses. You know that color, Janet? It's kind of
I'm looking that up. Tortoiseshell cat.
But anyway,
golden, brown, and black combination.
Yeah, it's a triple color.
Oh, it's kind of orangey.
Well, orange
and black.
But anyway, I think cats do even better on immunotherapy than dogs do. I don't know. They just seem, and I've had 80-year-old clients with very arthritic hands giving their cats their once a week or every 2 week allergy shot, and couldn't be happier with how they were doing.
It's amazing. Yep. And cats often manifest in different ways for those allergies too. My cat was just circling my feet, but I have a perfect example right here. she chews her hair coat out. So sometimes you think, well, they don't have a true skin lesion, but they're chewing their hair down, and you can hear her going,
Right.
Yeah.
Yeah.
Or sometimes they'll have an actual lesion where people think that they have a wound from something, but it's actually allergy. So it's a different kind of presentation sometimes. Yep.
Yeah.
Okay, so
Cats
she's
don't
licking
like
her
to do
hair off.
anything
The
by
normal
book.
way, right? Yeah.
Wait, so if the cat's licking her hair off, then I'm assuming a hairball's coming up at some point.
Oh yeah. Yeah.
Yeah. Okay, so if I'm a pet owner, it sounds like I have two choices. I can go on immunotherapy, which is owner dependent, or I could choose one of those other drugs that you brought up, I don't know all these drug names. One, if to me as a pet owner, if you're doing the allergy test, figuring out what's wrong, and then doing the immunotherapy, you're getting to the root of it.
Yeah, that's
right?
that foundation.
And in the long run, your pet's going to be better. I mean, I've seen it with 2 humans. But if you just go on the other drugs, you're kind of masking it, right? And I'm not a professional, folks, but
no, it's very true. And a lot of those drugs you can't even use on cats. So, they're only labeled for dogs. So that's a whole other challenge for cats. Yep.
So if I've got the dog with itchy paws, right, and I'm treating them and doing the immunotherapy, I'm waiting for him or her to get better, is there a topical to calm that
So
down?
you can use those other drugs to support as well, while they're while they're getting accustomed to the immunotherapy and building up that desensitization. It's actually a great idea to use other medication to support them, because you don't want them to be miserable for 6 months while you're waiting for the immunotherapy to take full effect. But just remembering that it's worthwhile to continue the immunotherapy, even if you're supporting them with other medication. And that you're saving them from that lifelong time on that, right? To Dr. Drummond's point, where you have to monitor blood work with Apoquel and make sure that there's not other things that are going on, as well as drug interactions, right? If they end up with another diagnosis, having that in mind. Immunotherapy, you can, if they have another diagnosis that you have to address, you don't have to worry about that interacting with the immunotherapy, which is really nice.
Is there a magic time when, like, I know my friend David has Rosie, and she was this wonderful puppy and excellent, and then she hit like 3.5, 4 years, and her paws, it was her paws, her belly, and it became an environmental allergy.
Yeah, that's a great question.
So does it happen at a certain time where owners should be a little more aware?
So younger to middle age. So somewhere in that 2 to 6 years is pretty typical. Yeah, but it can be any time. I've seen it in puppies, seen it in seniors. So it can span all of that. It's just that younger middle age is most common.
And Janet, the other thing, when we like today we have red tide at the beach. When you inhale that in, it's horrible. You get like an allergic reaction. But dogs and cats, they inhale it, but they absorb it where there's not much hair. So that's why their feet are involved, the insides of their ears, their tummies, their butt. So when they come in from outside, it's nice to rinse them off, but not soak them. Because if you have wet skin, you absorb better across the skin what you're allergic to. So rinse them off, pat them dry. Don't soak their feet. That's an old wives' tale. Oh, I soaked their feet for 5 minutes. Well, you know how when you're pruny in the tub, you're told to put your moisturizer on, right? Because
it'll absorb.
Right.
Yep.
Exactly. So with pets, well, cats, it takes a lot to be. Good luck.
Yeah.
But in dogs, we want to keep their skin rather dry as opposed to macerated and wet. So I always tell people, when you bring them in, just maybe have a little pan of water, dip, wipe, go on your way. But that's why it's usually underneath most allergies in dogs. You'll see how red they are in their feet, and poor things, they come in and just, and of course, while they're doing that, they're inhaling some of that pollen.
Inhaling more.
Right.
And then making it worse, because then their skin barrier is even more upset, right? As they lick and chew at it. So sad.
So do zoo animals, like exotics, do they have allergies?
They do.
I can tell you, I skin tested a clouded leopard at the Cleveland Zoo.
Oh my goodness, I love it.
Yeah, and that was when we didn't do any blood testing. It was early in my career, probably in the early 90s. The thing about zoo medicine is You go in there and everything's already sedated, laid out on the table for you. And this was a beautiful, breathtaking animal. And we shaved it, we allergy tested it, and Alana, I was so worried it was going to be dust mite allergic because it's an outside animal.
Goodness.
And it wasn't.
Oh, good.
It was very pollen allergic. We made up the solution, and the solution is supposed to go under the skin, the injection. Well, the curator, once a week, would lure the clouded leopard over to the edge of the cage, the outdoor cage, while he was getting the meat, just pop him with the shot. And I'm sure it went in the muscle or under the skin.
But it got in.
Yeah, but he did very well. But sadly, that was part of their breeding stock, and allergy is hereditary. So, yeah.
Yeah. But I love that question about exotics because we do, I will say, like Heska allercept has been used on a variety of exotics. Always recommend consult for the veterinarian before considering that option for an individual. But, you know, ferrets, rabbits, those other small exotics are the most common just because that's what, you know, gets seen the most. But certainly zoo exotics as well.
And horses, Janet. Horses are pretty allergic. They get heaves.
Really?
Mm-hmm. Yep, horses are.
That's a lot of space to itch.
It is. Yeah, you're right.
Well, and you can't really put horses on a lot of cortisone because they do something called founder, where then they get lame from it, and there's not much coming back from foundering.
Yeah. And horses often have more insect allergies too, which is a challenge when they're, you know, in a barn environment or even outside, or a combination of the two. That's a challenge to address those insect allergies.
Janet, it's like your no-see-em allergies when you come to
Oh,
Florida.
there you go.
Oh my
the
God. Just come hang out with me because they're just going to attack me.
What
It's
is
like,
it?
it's
What is it about
horrible.
certain people that they're worse with? My mother-in-law
I
is
think
the
it's
same.
hormones. I do. I think it's a scent. And then I go home and I'll be, are you kidding me? Are they in the luggage? Because like 3 days
she
later,
has
they're
a
still
delayed
up and up.
hypersensitivity.
Oh my
to them.
goodness.
Oh, is that what it is? I think they come home.
No, I don't think so.
Oh,
Yeah.
it's horrible. And I found this, whatever product that is that I send down to Florida when I go, and I literally, like, I'm a toxic waste dump. I coat
Yeah.
myself
Oh
in
my
it.
goodness.
Ranger Ready.
Ranger ready.
Oh.
But you know, Janet, right after the hurricane, it was horrible. They swarmed, and that spray was not doing anything.
Wow.
Picardin.
Probably because of standing water, I would assume.
Yeah, I think so.
Even here, like mosquitoes comes find me immediately.
You know,
Yeah.
we should also ask Dr. Lozano, what's the success rate for
Yeah.
the oral immunotherapy, sublingual, or the injectable? Because people aren't going to do this if it's only a 20% success rate.
Yeah, you're right. And the success rate is between 60 and 80%, depending on the study that you look at. So it's pretty decent. Certainly not every pet is going to respond, but it's worth a try, right? Lifelong disease. You want to know if they're one that would respond. I've had so many clients tell me that the immunotherapy ended up saving them so much money and heartache and trouble over the long run, right? Because when their dog or cat does respond, it saves them not only the medication, but also their pet isn't uncomfortable anymore. And also vet visits. I mean, we love seeing them, but we only want to see them for good things if possible. So if we can save them all those ear infections or skin infections and the other things that come with allergy, it's worthwhile.
And the other thing,
And you're not up as a pet owner listening or hearing that
too.
scratching. Or
And
the
I mean, we've
well, the
all,
other thing too,
well, maybe not
you
everybody.
bond right, and
We've
you
been
bond
there.
with this pet because you're
Yeah.
watching how they're doing, you're giving the shot. It's really a loving way,
Yeah.
I think, to treat. It's not just here, take this drug, and guess what? We better do some blood work because it could be adversely affecting you. But it's if you ever, I would tell clients, if you're into natural, it doesn't get more natural than this.
100%.
Yeah.
And if you're one of those that likes to have your dog or cat in, laying on your bed when you sleep at night, you want them to smell good and you don't want them to smell like yeast and you don't want them to be scratching or licking all night. Right. So it's worthwhile.
That's true. Because like Alana said, not only are ear infections accompanying this, yeast infections, we all know what that smells like.
Yeah.
Bacterial infections. It's like the start of snowballing. And allergy is at the base of that.
Yeah.
It's hard for people to realize that because, sometimes I'll get, and the other thing too is I've also seen the opposite. where unfortunately a pet has been blood tested for allergies. Maybe they're 13 years old and they're scratching like crazy and they never did this before, but yet it's mange, it's scabies mites. And and the thing is, as a veterinarian, as a doctor, you have to weed out the things that look like allergy, because I don't want to spend somebody's money on allergy testing a pet when maybe they've got scabies.
Right.
Because both those diseases are itchy.
Yep. And on that note, sometimes it takes more than one test to get your answer, right? Often it takes more than one test. Even with things like checking for mites, I've had it, as a vet where I scraped one time and didn't find any. They come back a month later, we scrape again and we found them. It's persistence and perseverance when you're trying to figure out, being a detective through that whole process, which is challenging sometimes.
What about the time of the year? Is that important in testing an allergic pet?
It is, yep. So when we're looking, especially blood tests where we're looking at those IgE antibodies, they're going to be the highest when the pet is exposed to whatever they're allergic to. So considering, you don't yet know what they're allergic to, but you can see the clinical signs, right, when they're showing the symptoms of allergy. And so that's the ideal time to test.
Well, Dr. Lisano, I got to ask you our questions that we ask all of our guests.
Oh.
What about your work? How do I want to word this? What about your work motivates you and keeps you going?
I love that question. Yeah. So when I was in clinical practice for 11 years before I came over to product management with EMTech, was with HEFCA originally. And what it was, I will admit that I had a little bit of a crisis initially because I was so used to seeing right in front of me the difference I was making, the difference for the pet, the difference for the pet's family. That's really what motivated me in clinical practice. So when I moved over to industry, it took me a little bit of time to figure out how am I impacting the veterinary community and thus the pets, right? And I've realized with time that I actually can have an even broader impact, an even global impact now. And that's what motivates me, is truly making this, a better world for those families.
Thank you so much, Dr. Lisano. I learned an awful lot. I mean, I knew the human part of it because I've experienced it, but not with a pet. And this is, I think, really helpful to our listeners.
Likewise. I was so excited you reached out because I've listened to your podcast and it's just so much fun. So you guys are great.
Wait, that's one. No, we're kidding. We have a lovely audience.
I'm so glad to hear that. And and please stay in touch. Let me know when you're at conferences and such. So
absolutely. Yeah. Hey, listen, this has been, it was great seeing you again. I hope we always keep in touch.
Yes.
And Janet, I'll see you next week, right?
Sweet.
Yeah. Thank you, Dr. Lisano. This was really informative and really appreciate the good work you do. Thank you.
It was fun. We didn't even have cocktails.
Yeah, right? Think of how much more fun we could have.
I know. Next time, cocktails are on us. Hey, this was a great session today. I can't thank Dr. Lisano enough. It's always fun to get together with her, and I always learn so much. And I hope you all have learned a lot in this hour about allergy and immunotherapy. Ask your vet about it. See a veterinary dermatologist if you need to. Go on the ACVD website, click on Find a Dermatologist, and there'll be one in your region, I promise you. Anyway, this is Dr. Alice Novotny-Jeroman and
Janet Novotny-King saying thanks for listening. Don't forget to love up your pets and extra biscuits from us. Thanks for listening. Bye-bye.
Bye-bye.
Bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.